All right, so then to summarize the conditions, when we talked about other areas, we've gone through the same kind of program of conditions. So what do we usually talk about first? Yeah. Okay, so what kind of things do you think are going to happen with the elbow? How do you get to injure your elbow acutely? Either you're going to do a push, all right, or you could fall and hit directly on the elbow. Okay? So we'll talk about that, and then what kind of things you think are going to happen with that? Yeah, traumatic conditions.
Fracture.
Okay, yeah, so it's, in nerve tissues it's going to be bones. What else? What holds the bones together? Ligaments. So you have ligament tears. What's that? Yeah. Right. So yeah, if the ligament tear is bad enough, you can whack the whole joint out of position, or you can just tear the ligament itself. Then when you have those types of injuries, you can have complications that can go along with that. So what kind of complications could you have with those, with like dislocations and fractures? You can have those nerves or arteries that are going through that area that can have problems. Okay? All right, then contractile tissues, what kind of problems are you going to have with that? Or I mean, what types of mechanism of injuries you have with that?
Overuse.
Yeah. So you got your tennis elbow, you got your golfer's elbow, that kind of stuff. You can, in this case, there is a ligament that we'll talk about that can be a repetitive injury, where you have the ulnar collateral, medial collateral, where you talk about like little league elbow, or like kids that are pitching, or baseball pitchers. That can just have an overuse, chronic stress and strain to the medial collateral ligament. But other times, most of the time, it's going to be dislocation. Okay. Anything else? That's pretty much it. There's going to be a few other things that we'll get into more detail, but that's pretty much the summary. So you just want to know what's unique about each of the conditions. How are you going to identify that as far as mechanism of injury? Is it an acute condition? Is it a chronic condition? What kind of complications that you can have with it? And then get into special tests of the elbow. Or also like red flags. What kind of things would be red flags that you would have to, something that you wouldn't treat, that you would send somebody off to emergency room for an elbow condition?
I think there was such severe swelling that talking about the hemorrhage.
Yeah, I mean a fracture, or if they have a dislocation. Obviously if it's acute dislocation, you're not going to deal with that. We talked before, like with the shoulder, you could have, there's not so much that you're going to have internal organs that are going to refer. But yeah, I mean, mostly the elbow, the red flag things are, fractures, dislocations. If they have an injury and then they're having effects where, you're checking the pulse, you got to assess the vascular condition and the nerve, see if there's any nerve injuries if you have a dislocation. Same kind of thing in the shoulder. And then special tests. So basically, if we're going to test the ligaments of the elbow, you can kind of guess what we're going to be doing, right? If you're going to test the one on this side, what are you going to do? You're going to push it over this way to stretch that ligament, right? On this side, you're going to stretch it over the other way. There's not really much you can do for the annular ligament, except maybe you might, do something like this and track it in here. Or you could check, if you put it in a loose tack position, and then check for joint stability there. So, all right, so then for contractile conditions, what types of special tests do you think we're going to do for that? What do you do to assess contractile tissue? There's two different things.
Active and active resisted.
Yeah, active range of motion and active resisted range of motion, but also you can stretch it at passive and range. So if I'm doing this, what tissues am I stretching? Yeah. So I can either do it by active resisted, or I can passively stretch it at the end. So if I wanted to do that for the medial epicondyle, it's do this, or you can stretch it that way. And then what kinds of things do we do for nerve tissue tests? Yeah, so you can tap on it. So where do you think we're going to tap on there? Right here, right? Okay. Then other things you do are things to either stretch the nerve. So we're going to do this to stretch the nerve in the cubital tunnel. Then You do other things where if the pronator teres muscle pinches the nerve going through there, we're going to do something that's going to contract the pronator teres muscle. So we'll do a test where we're going to contract the muscle to see if it squeezes on the nerve. Okay? So that's pretty much it, right? So we can just go home, right? Yeah. Let's go a little bit more into it. All right, so again, we said what kind of bones you have. You have the humerus, the radius, and the ulnar. And then we talked about the different joints, right? We have the radial ulnar, the radial humeral, and the radial ulnar. And then basically the ulnar humeral, basically that's kind of, you have to consider one joint as the primary joint of the elbow, that would be it. And it's a modified hinge joint. So basically it's just going to do flexion extension. Right?
So the radial is the ulnar humeral is the primary.
Ulnar humeral. Did I say radial? Okay. Ulnar humeral. Okay. Because that's the one that's just going to allow flexion extension. And then if you're talking about the radial humeral, that does flexion extension, but it also does what else? Pronation supination, right. All right, so then there's the radial humeral. And then, well, in this case, we're talking about superior radial ulnar, or we call it also proximal radial ulnar. That's going to be, this is where the actual pronation and supination is occurring right there. As you can see, the head of the radius pivots with that joint. And then this is the middle radial ulnar articulation. Again, it's not a true joint, but it has the interosseous membrane. And then we'll be talking about the same thing when we get into the lower extremity. There's one between the tib and the fib.
What type of joint is the radial joint?
It's another hinge joint too, but it also is a pin. It's a kind of, I guess you'd call it a modified hinge joint. Because you're talking about two different motions. Well, if you talk about this, I'm sorry, what, you said the radial
Yeah, the radial.
ulnar, I guess that would be a pivot joint.
Yeah.
So then you have a modified hinge joint between the radius and the humerus, and then the radius and the ulna would be a pivot joint. So basically, it's just moving in one plane, right, in the transverse plane, whereas flexion extension is in the sagittal plane.
So the superior radial ulnar is proximal or distal?
Proximal is always towards the center of the body. So this is proximal and this is distal, which is also, this is superior and proximal, and this is inferior or distal. Right? So when you flex, like if you're doing passive range of motion on your elbow and you go here, how does that feel? It's not really a hard endpoint because it's kind of spongy because you got a lot of soft tissue in there. Okay? So it's a soft muscle end feel. Whereas extension, that pretty much, you can tell when it's the end of the line, right? That's more of a bony end feel. Okay? And then you have pronation and supination, which is the proximal or superior radial ulnar joint.